Hello everyone, I am Dr. Surya Prakash Hedda, consultant neonatologist and pediatrician, Renova Hospital, Sanat Nagar. So today we'll discuss one of the important topic, that constipation in our children. So what are the causes and how to go about it? So most important is constipation. What is it? That is has to be understood by the parents, because every baby may not pass motion once or 2 to 3 days. That may not be a constipation. That depends on the frequency, the consistency, and the days which the baby is not passing. So what we medically call it as, if the baby is passing a hard stool once in a 3 days, so we take it as a constipation. So that may be physiological or a pathological. Pathological in the sense it has to be related to some diseases. So most common what we see day-to-day practice is a functional constipation. So coming to the what is functional constipation. Suppose if the baby is passing motion less than 2 times in a week, or if the child is passing a hard stool, or the stool diameter is very much significant, that is causing obstruction in the bathroom. So that is where we call it as functional constipation. So in a functional constipation, we may not have anything related to the body. That means the organs are perfect. Only thing is there is some behavioral issue or problem with the food. So there are therapies which needs to be attended to the babies, where the physiological constipation, what we call it as functional constipation, has to be addressed. So that can cause detrimental to the baby's behavioral further on if unattended. So what are the other causes of constipation? We have an anatomical problem, that is from the anus till the esophagus. So that can cause also a constipation. So certain diseases are there which can cause a constipation, like most common in day-to-day practices, like TB is also one of the cause, where abdominal TB can present with diarrhea or a constipation. The second is celiac diseases, inflammatory bowel diseases, or for that matter, sometimes we call it as habitual constipation. So sometimes there is something called as anorexia nervosa, where the child eats more and tend to vomit. Those children also can come up with a constipation. So this is a broad terminology where we define a constipation and causes. So coming to the age-wise distribution, suppose in the newborn period, the mother tells that the baby is passing once in 2 to 3 days, but the consistency of the stool is normal. So that is not a constipation. Normally the babies tend to pass once in 3 or 4 days. That's a normal. That doesn't fit into the definition of a constipation. So the other age group, like a children, that adolescents, so as we already discussed, there could be problem with the food habits, or sometimes there will be problem with the fissures. So there is something called as anal fissures, where the child tend to have a retentive stools that itself can result in a constipation. So what are the things where the parent should be knowing when to seek a doctor when the baby has a constipation? So there are something called as red flag signals. So where the parents has to be known, if these symptoms are there, then you should seek a medical opinion. So you should consult a doctor if following symptoms are there. Like suppose if there is persistent vomiting. Constipation generally doesn't occur with a vomiting. Suppose if the constipation is causing excessive vomiting, so that is an indication that you should consult a doctor. The second most important is if there is a blood in motion. Suppose if the constipation, if the child passes a motion along with the blood, so that is the time you should seek a medical opinion. Suppose if there is a blood in vomiting, so that is also a danger sign where you should go to the medical doctor to seek an opinion. Suppose if there is a excessive vomiting along with that pain abdomen. Generally, constipation causes slight pain abdomen. Suppose if the pain abdomen is associated with vomiting, so that is a time that you should seek a medical opinion. So the next most important where you should seek a medical opinion is constipation associated with blood in vomiting. That is itself is very dangerous. The next most important is if the child is very much dehydrated. So if the constipation child is getting dehydrated, that is the time you should seek a medical opinion. So these are the broad red flag signals where you should seek a medical opinion. Now many parents ask, what do we do? So when to take a medicine? Is it a right way to take a medicine over the counter, or should we wait, or should we change the dietary pattern? So all the constipation may not require medications. So some of them are curable with the dietary modification, lifestyle changes, and some amount of exercises. So next session will deal all those things, how to go about for a prevention of a constipation, or for that matter treatment of the constipation. So this is a very broad terminology where we are discussing about what is constipation, so what are the causes of a constipation, and when you should seek a medical opinion. So thank you one and all.